Hi, Dr. Larry Altshuler here, talking to you about healthcare and healthcare reform. Telling you things that you won't hear in the media and you certainly won't hear from the politicians. Now, this is the second video in a series of 3 about primary care. In my first video, I explained to you that primary care is very, very important, but we're losing all our primary care doctors. Everybody's going into specialty care. And we can't afford that. That's going to cause a lot more waste, a lot more expense, and decreased quality of care. I also explained that in order to incentivize primary care doctors and to get more doctors to go into primary care, we are going to have to increase their income. The first 2 provisions from the Affordable Care Act that I mentioned in this last video won't do that at all. It's just going to increase the number of doctors, and that's not going to help anything because they're all going to go to specialty care. But there is one aspect of the Affordable Care Act, one provision, that actually tries to increase the income. But as you're going to see in this video, it's not going to work very well. So what is that? Well, it's called the Comprehensive Primary Care Initiative. And what it is designed to give bonuses to doctors to provide coordinated care. In this provision, the government is going to provide bonuses of $20 per Medicare patient per month for patients to do a variety of practices. Those include the following. Number 1, they want the doctors to help patients develop and maintain personalized care plans if they have chronic diseases. Number 2, they want doctors to provide 24-hour access to healthcare and healthcare information. Number 3, they want them to provide all this preventative care. Number 4, they want to help patients and their families learn how to care for themselves. And number 5 is where the coordinated care comes in. They want them to work with other doctors to provide this coordinated care. Now, I'm going to tell you that all 5 of these areas are very, very important. And they're areas that we really, really need. But unfortunately, there's problems with this provision. And let me tell you what those are. Number 1, all these areas have barriers to them. Let's just take preventative care. A study at Duke University several years ago showed that for a primary care doctor to provide all the preventative care that the government wants them to would take 7.5 hours a day. So all they could do is preventative care. They couldn't even see patients and treat them for other things. Again, that's just one example. All of these are great ideas, but they've been addressed before, and there's lots of barriers, and we haven't been able to really accomplish them. So that's number 1. It's going to be a really difficult task. Number 2 is a little bit worse because this money, this bonus money, which can be up to 10% of a primary care's income, the government is expecting the money to go into infrastructure. In other words, increase medical staff, apply to electronic health records, to provide the 24-hour access to health care. In other words, this bonus money is not to increase the primary care doctor's income. It is only so that the doctors can provide more services and then they'll get reimbursed for those services. But it doesn't do anything for their income. Unfortunately, this will not incentivize primary care because what's going to happen is they're going to end up doing lots more work and not make any more money for it. So that's not going to work. Number 3, coordinated care. Great idea. But it's been tried before. It's not a new idea. It's been tried in many pilot programs over the last 20 years, and the Congressional Budget Office has actually examined that and said none of them worked. They didn't decrease medical costs. They didn't improve the quality of health care. Number 4 is that this whole initiative is more than coordinated care. I told you about these 5 major areas. They are huge, huge, broad areas. They're going to take an enormous amount of time and effort and overhead to accomplish it. And I'm going to tell you that this bonus money won't even come close to paying for it. These doctors, in fact, are just going to be working and working and working more and seeing more patients and doing more services, and yet their income will not go up at all. And that's going to defeat the purpose once again. So those four things are aspects of this provision that are really going to make it fail, unfortunately. But there's another aspect that may even be worse, and that is that the government is saying that a year after these primary care doctors do this coordinated care, they're going to start evaluating those doctors with criteria for quality of health care. Now, here's the deal about this. Number one, the criteria haven't even been determined yet, okay? And if you've been looking at my other videos, I have shown you in many of the provisions of the Affordable Care Act that, and in the pilot programs that have been tried for the last 20 years, all the measures that the government have established have not been good measures. They have not translated to better health care and lower cost. They haven't. They failed miserably because those measures aren't the most important ones. And these criteria, when they're established, will most likely be in the same category as the rest of the government measures. That's just not going to work. But there's a little bit sneakier proposition here, because really what the government is wanting to do is look at what these doctors are doing. Now they're saying, well, you know, if you save us money, maybe we'll take some of that money and give it back to you. But that's a big if. Really what the government wants to do is use this provision to look at what doctors are doing and actually control them. Have them do what the government wants them to do. And that's really the basis of this last aspect. So unfortunately, this provision not only is not going to work, it's going to fail miserably, but it's actually going to drive doctors away from going into primary care. They're not going to want to have, to get into this, they're not going to be incentivized. So with that in mind, what can you do in the meantime? Well, if you get a good primary care doctor, they're valuable. In the meantime, however, they're pretty busy. I urge you to go to my website, balancedhealing.com. There you'll find out lots and lots of information on how you can really get the quality of health care that you need, get the most cost-effective care. You'll get lots of information, and I list all my videos, and you can go back and look at those videos and see what I'm talking about in those as well. So in the meantime, thank you for watching this video, and I urge you again to come to Balanced Healing, and I think that you will really enjoy all these videos and my website. Thank you so much.